Good evening all, this is Hadeel Alhamad. I'm 25 years old from Jordan. I'm a graduate student from Jordan University of Science and Technology. I'm a registered nurse in King Abdullah University Hospital in coronary care unit for more than 3 years. While I have been working in my area, I have noticed that many patients with heart failure have admitted and readmitted for the same reason. And after I have asked them about the reason, they reported that they don't have enough information regarding the heart failure and its management or non-pharmacological management of heart failure. And they reported also that many of the information provided to them, they have been lost or forgotten since they are documented or printed on paper or given verbally. As we know, heart failure and its management remain a big challenge to the healthcare professional and the stakeholder. And one reason for this challenge is the lack of knowledge. Lack of knowledge may be the reason for increased readmission rate, increased comorbidity, increased non-adherence, and impaired self-care, and decreased quality of life, which put us as healthcare professional under a big burden for solving this problem. So as we know also that coronary cardiovascular disease and heart failure is one of the cardiovascular disease that leading cause of death from the total death from cardiovascular disease, and may reach in Jordan 8.7%. And as we know that cardiovascular disease management is one of the main priority research area in Jordan, and in the Europe funded health promotion and disease prevention, one of the major concern of the Europe research funded our project under the title of the effect of using mobile health education application on the knowledge of heart failure patient, Jordanian heart failure patient. Dutch heart failure knowledge scale will be assessed pre and post the intervention. The intervention is by using mobile health education application that be installed to the participant in the experimental group, 68 in the experimental group and 68 in the control group. The control group will receive an educational routine educational program, and the experimental group will receive mobile health education application that will contain the salt restriction and fluid restriction and the daily weight monitoring and the sign and symptoms that seeking the healthcare professional. A phone call over Q2 weeks for the participant if they have further investigation, and post-test will be used after 3 months of the participant will be distributed also Dutch heart failure knowledge scale to assess the level of knowledge of the